Julia Child once said, "Those who love to eat are always the best people." Now, while we can debate that, Jim Brillat Savarin offers another perspective. The type of food we eat defines who we are. Think about it. The choices we make with food says a lot about how we live. And let's be honest, we all love to eat, but sometimes what we are eating doesn't love us back. In today's busy world, balanced eating often feels like an afterthought. But when we don't pay attention to what we put into our bodies, the consequences can be far more serious than we think. Yes, talking about diabetes. People often believe it is just about staying away from sugar, but it is not that simple. Diabetes is a silent intruder, creeping up on us quietly. It is a condition that can slowly break down your heart, your eyes, your kidneys until your entire body feels the strain. With over 400 million people worldwide living with diabetes and 1.5 million deaths linked to it each year, it is a global crisis, and that is why on Health Options, we are turning our focus on diabetes. Together, let's explore what we can do to understand and manage this serious condition. I am Salwa Khalil Ibrahim, and I'm so glad you're here with us. Living with diabetes can feel overwhelming at times. Managing blood sugar levels, keeping up with medications, and making the right food choices. It is a lot to handle. But here is the good news. It is not a life sentence, and with the right approach and care, you can lead a healthy, fulfilling life. But first, let's take a short break. When we come back, you will be meeting our guest, a specialist in diabetes. Please stay with us. My guest is a consultant physician and an endocrinologist, Professor Felicia Anuma. Many thanks for joining us, Prof.
Thank you for inviting me.
Okay. What it is about diabetes and the types of diabetes we have?
Okay. Diabetes, in simple terms, is when the body loses the ability to utilize glucose properly. That is what we call diabetes. And there are different types of diabetes. We have the one we call type 1. That one occurs in, younger people. And then we have the type we call type 2. Incidentally, majority of the diabetes cases we are talking about, like 95%, is type 2 diabetes. And then we can have what we call gestational diabetes. That is blood sugar going up for the first time during pregnancy. That is what we call gestational diabetes. And usually after delivery, majority of it resolves, but it can be a risk for diabetes in future. And then we can have diabetes due to other conditions, other diseases that can present with diabetes as part of the presentation. So the chronic complications of diabetes, particularly if someone has been diabetic for a long time and control has not been good, it can affect actually virtually every organ of the body. Okay. The brain, the eyes, the heart, the kidneys, the nerves, the blood vessels, and then they can present with all kinds of, symptoms from the chronic complications of diabetes.
So what are the warning signs for diabetes? At what point should one be worried that he has diabetes?
Well, the truth is this. Diabetes can be, blood sugar can be high and the individual is not having any symptom whatsoever.
Oh, wow.
And that is why it is important for, medical checks so that, and blood sugar is amongst those things that individual should, check out for each time we are doing medical checkups. Then we can have a group that can present with what we call the classical symptoms of diabetes. Okay, the individual is eating too much, urinating too much, drinking a lot of water. So when these symptoms are there, that individual should go and find out what is going on. Then we can have another group that may not even manifest these symptoms I've just mentioned, but they present with the chronic complications of diabetes. When blood sugar has been there for a long time without good control, then it can begin to destroy the organs, okay? So somebody can have, you know, you are not seeing clearly anymore. The person goes to the eye doctor. The eye doctor examines and finds out that it is, you know, the impact of diabetes on the blood vessels in the eye. Somebody can present with a stroke in the emergency, with a heart attack in the emergency, and it is diabetes. Somebody can come with a gangrene on the foot, which eventually, you know, usually we have to amputate, and it's a complication of diabetes. People can present with kidney failure, and it's complication of diabetes. Okay, so then there are there's another group that can actually collapse suddenly at school or in the office or at home when blood sugar gets very, very high. So they rush the person to the emergency. Any diabetes, they will say no. But when we check, the blood sugar is in the sky. So there are various ways that, you know, diabetes can present.
Okay. Now, we learned that one can inherit diabetes, but beyond the hereditary type of diabetes, how can diabetes be acquired? And then again, are we seeing more of diabetes in the African continent and Nigeria in particular?
Yeah, thank you for that question. The truth is we are seeing more and more diabetes cases. Diabetes is becoming a time bomb that can explode anytime. Now, you asked about, you know, the hereditary component of diabetes. Yes, there is a hereditary component. In type 2 diabetes, for example, if one parent has diabetes, any of the children of that parent has a 40% chance to have diabetes at one stage or the other in his or her lifetime. But I'm usually quick to say the person has a 60% chance in his or her hand to get well informed, get empowered, live right, and avoid having diabetes. Now, there are and if two parents have diabetes, the individual has as much as 70% chance. And if one sibling also has diabetes, a brother or a sister, the person has a 40% chance. Now, there are other reasons, what we call risk factors, why people, you know, become diabetic, and those risk factors are mainly environmental. And when we talk about prevention, those are the issues that we should strongly address.
Okay, many thanks, Prof. Now, we'll take a short break here. When we come back, we'll talk more about the management of diabetes. Don't go away.
Kuka that's the name in Hausa.
And that is call it Oshe.
In Yoruba.
Oshe, Igi Oshe.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
If you just joined us, the program is Health Options on the NTA, and we have been talking about the management of diabetes, and my guest has been a consultant physician and an endocrinologist, Professor Anuma. Many thanks for being there, Prof.
Thank you very much.
Okay, now for those that may have or have been battling diabetes, what is the best way now in terms of diet, in terms of insulin shot? Now, what are the best measures of management of this ailment?
There are various ways we treat diabetes. There are a small group that just by modifying their diet, their lifestyle, stopping smoking, stopping drinking alcohol and all that, we manage them and, you know, blood sugar normal, and they continue in that line. But we have another group that we put on tablets. They can make do with tablets, and what is important is for blood sugar to get controlled. Actually, the method we use is not very important, like blood sugar getting normal, to prevent or delay complications. So we have a group we give tablets. Then we have another group that we give a combination of tablets and insulin. and then we have the last group that they are completely on insulin. What determines what we do really, or the method we use, is the level of blood sugars. What is important here is let blood sugar be normal. So we can use any of these options to make blood sugar normalize.
For example, now, somebody who has diabetes, there are a lot of things not to do, not to eat, especially in terms of food. And in this part of the world, Nigeria in particular, I know there are different types of food, and managing diabetes, we all know, could be different. Now, as a professional now, what is your advice? What is that key component that one can do in terms of management of what to eat in particular now?
Okay. Well, dietary modification is a very important component of diabetes management. Well, the idea is we shy away from saying there is a diabetes diet. We don't want to say that there is a diabetes diet. What we will rather say is a healthy diet for every family member. That is the truth. Anybody that wants to, live healthy, age gracefully, actually should eat like, somebody who has diabetes. Then you are not going to have it. So the important thing here is in dietary management of diabetes is things that are sweet. When we put it in our mouth that tastes, immediately sweet, they contain what we call refined sugars. And refined sugars are sugars in their most easily absorbable form. So once you swallow it, they run to the blood to increase blood sugar. That's the only absolute rule we have in dietary management of diabetes. Otherwise, the person can eat anything. It's just that there is a modification to it. Okay, so it is not the name of the food that is important to us. It's not whether it's rice the person is eating, or it is yam, or it is swallow. What is important is how much is this individual eating, the portion size, the quantity, and then with what. These are very important. For example, with what we mean the amount of vegetables that, is contained in that person's diet. And of course, when we talk about oil, we want that individual to step down oil to the barest minimum, no matter the name of the oil. Whatever the oil is called is not important, but step down on the quantity of oil that individual consumes. And of course, we step down on the amount of salt that individual consumes. So the idea is not to detach this individual from his normal food environment. What we want to do is to modify so that this person can still enjoy his life.
Okay. Can diabetes be reversed or cured, if you like?
Well, the cure, let me say, for now, no. But we can control diabetes so that individual lives his normal life like any other person. Reverse, particularly type 2 diabetes, let me say there is a little percentage that is possible if they become hardliners and very disciplined and avoid all flesh. It is possible to reverse type 2 diabetes. And when I say reversing all flesh, I mean no fish, no meat, no chicken, no flesh at all. All right? The person is completely vegetarian. Then it is possible.
Especially Nigerians, we like to enjoy, we like to eat. Okay, so that is possible in terms of controlling the diet. I want you to re-emphasize on that, especially what we eat. I know earlier you said, modification of diet, and then, of course, quantity control is very important. I want you to re-emphasize on that, especially for those managing diabetes.
Okay, thank you. Well, yes, the diet is very, very important, in the management of diabetes. Like I said, all fizzy drinks, the answer is no. Sugary things, the answer is no, because those ones will quickly run into the blood and increase the blood sugar. And then the food, the portion is important. So we are not saying you can't eat rice. We are not saying you can't take swallow. In fact, when I see my patients, I tell them that I can allow them take swallow, no problem, even those that love pounded yam. But the size of my own fist, not their own. And then they feel it is too small, and I tell them no, it's not small, because if they eat the size of my fist with a bowl of vegetable soup, that suffices. The vegetable is bulk, and so they are not going to get hungry because it will fill the space. But very importantly, when we encourage them to eat food that contains a lot of fiber, And our sources of fiber are vegetables, fruits, and whole grains.
Some people might be concerned about the cost of food these days now.
Well, I think what we can do is to prioritize. We prioritize. You know, maybe the money you would have used to buy chicken or to buy beef, you can divide that into two and use that 50% to buy your vegetables and your fruit. So I think it's prioritization that we need to do at this kind of difficult time that we are in.
For those that have diabetes and been managing all kind of ailment associated with diabetes or occasioned by diabetes, is it possible for them to live a normal life like every other person?
It depends. High quality care will help delay or prevent complications. But the challenge we have in our setting now is that care has become very, very expensive. Medications have become very expensive. A medication that my patients were getting at 5,000 naira per month, 7,500 naira per month. Those medications now are 30,000 per month or 45,000 naira per month. How are they going to sustain that? So if our patients are in this situation now and they cannot afford their medications, then what is going to happen? The consequences are that we are going to be seeing more heart attacks, more strokes, more kidney failures, more gangrenes in the hospitals.
Okay, now you answered my question I wanted to ask. There is a target now by WHO to halt the increase of diabetes by 2025. And here we are talking about, the cost of treatment now. In Nigeria now, where are we? Is that possible?
Of course, even with the present situation we are in, we know it's not possible. But there is something I always emphasize, I hammer on every time I have the opportunity to talk on media about diabetes, is prevention. Prevention in our circumstances is the cheapest option we have. And therefore, people should pay attention to that's prevention. That's why I was, happy to discuss some of the risk factors so that those who are, for example, somebody who has a family history, that person knows that he has 40% chance of having diabetes. So that person very early should get empowered, knowledgeable enough, live right to prevent having it. Because, diabetes is a very costly disease. It's a very expensive disease.
Wow.
Let's face it. So prevention is our cheaper option in a country like ours.
Okay, on a final note now, I like to ask this on the program now. What are some of the most common misconceptions you've heard and you would want to address about diabetes now? What are some of the most common misconceptions you hear from your briefly?
Okay, one of them is that it is an infectious disease. Okay, so they stigmatize the individual with diabetes. Diabetes is not an infectious disease. Diabetes is a non-communicable disease. So there is no way you can get diabetes by, getting in contact with another person. So it's not an infectious disease. And then the other thing is that people who have diabetes, it means they are dying. No, diabetes does not mean death. Diabetes can be managed, especially if that individual is having quality care. That individual can live his or her normal life. Another problem is that people who have diabetes, they are not supposed to eat carbohydrate at all. It is not true. They can eat carbohydrate. It's just that we modify, like I had explained earlier, we modify the type of carbohydrate and the amount of carbohydrate that they are putting, in their foods.
Okay, many thanks, Prof, for coming on Health Option and for that educative insight. Professor Anuma, many thanks for being here.
Thank you very much for inviting me.
Next, let's take a moment to connect with nature. In our segment, Nature's Corner, we'll explore how natural remedies and lifestyle changes can support better health.
We talk briefly on diabetes. Diabetes is at the root of most of the heart diseases, along with high blood pressure. If this situation exists and there's diabetes, a number of local materials are available for use in the treatment of this situation. In our experiment, we have seen that mango, your common mango, the leaves have been used in a boiled form and drank to reduce incidences of high sugar level. In the same manner, the common garden egg, you know, which can come in different forms. It may be yellow, it may be green, and it may be white, have been used in the treatment of diabetes. The combination, we don't need to go, we're not making you to become either scientists or manufacturers on your own. It's just to let you know that the various things that are available within your compound can be used. In your kitchen, actually, can be used for all this. The time-tested beetroot, when it is drank, it has a lot of effect on sugar level. When it comes to high blood pressure, we'll still mention it, because they have dual uses. Now, your time-tested onion, the red onion and white, when they are intricately combined, we see effects on the high sugar level without any side effects. And here we have the well-known cocoyam. It could be white, it could be red. It has a lot of insulin effect. It can reduce sugar and moderate the insulin sensitivity of the human system, which is a major factor in diabetes. Then cucumber. Cucumber is a superfood, just like zogale. Zogale is here, same way cucumber is here. They are all very, very good. They are superfoods all over the world. And when they are used in combo form, they can go a long way to bring down the sugar level. In similar way is guava leaf. Guava leaf and fruit can reduce sugar level, even infection, even bleeding. Sugar. That is a guava leaf. And that is why I read in the internet, 13 pieces of very good leaf can go for as much as $13. You can see just the leaf. That is why it's that expensive. And then the thyme okra. Okra is a fantastic, it's another superfood. This okra, they come in different forms. Ewedu is there. And another one from my dialect, they call orodudu, is there. When they are combined, they bring down the sugar level in a very fantastic manner. So also we have cashew leaf, and cashew seeds. They are all very good, including miracle. This is our time-tested original miracle leaf. They are all very good in issues of high blood sugar level. So this is just to let you know that things that are within your vicinity, when they are used within very standard normal amounts, they moderate the sugar level of the human system, and they do not cause any side effects.
That brings us to the end of today's episode of Health Options. Before we go, I would like to leave you with this thought. Health isn't just about what we do when things go wrong. It is about the choices we make every day. So take a moment to reflect on how you are treating your body. If you have been touched by anything we discussed, feel free to reach out to us via our YouTube channel at NTA Network, where you can always watch these and previous episodes of the program. I am Salwa Khalil Ibrahim, and it has been a pleasure having you. Until next time, take care of yourself and stay healthy.